What we're gonna do is we're gonna make a hole in the inner part of the ear so that we can drain it. Then we're gonna clean it as well as we can, and then we're gonna place some sutures to decrease the chances of it filling back up with blood. There we go. Temperature, heart rate. We use a straight needle for this procedure. There we go. So your fluid rate is the rate in which you want your patient to get fluids per hour. Getting fluids during surgery is for maintaining body temperature, heart rate, blood pressure, a bunch of things. So we want to keep them hydrated during the process to make sure that his body stays at normal levels. We're going to do an ear hematoma repair surgery. This is basically an ear hematoma. Is blood in between the cartilage and the skin. On this patient, it was caused due to trauma, but on some patients, it's caused due to ear infections. They flap their ears, and then that can cause trauma and fill it up with some blood. We're going to try to decrease the best way possible the amount of dead space so that it doesn't fill back up. I'm going to put a little bit of lidocaine to try to block the region so that it's a little bit less painful on that side and then on this side. So there's also a couple of ways that you can do it. Like some people just make that incision and that's it. Here we like to actually cut off some skin so that it can continue draining and not close back again. And then if it drains, then it's just gonna stay in there trapped. So we like to cut a little bit of that out. This is the tiniest ear hematoma I've had. Like the ear per se. So it's a little bit harder. All of that was like the blood that was stuck in there. Okay. And then I grab that piece of skin and cut it out. So now there's an actual hole. And you can see the yellow part whenever it stops draining. The yellow part is the cartilage and then the skin surrounding it. And that's going to heal by what we call second intention. Okay. We use a straight needle for this procedure because it makes it easier for us to pass it through the whole ear. And then on this procedure, I really like to use sterile IV lines where I'm going to use them to suture a little bit tighter to make that skin and that cartilage a little bit more tight without causing a lot of trauma, you know, making the sutures tighter on the skin. I have this in between, so I cause less trauma. This is the fun part about the surgery because it makes it a little bit, you take a little bit longer, but the results are better. It will look very beautiful when it heals. So the sutures go on the outside of the pinna. So I just place this in here. I decide where I want to start. Being really careful. A really long needle. Perfect. So, goes on the outside of the pinna, still maintaining this hole open. I'm gonna go surrounding that whole hole. This surgery, there's always a risk of the ear filling back up, but you know, making it really tight, you decrease those chances. And that's why I incorporated using this plastic tubes, because I can make it tighter, but at the same time, not causing a lot of trauma using the suture, because this suture, if you make it really tight on the skin, you can cause a lot of trauma. But if I use the tubes, I can make it tighter, but you still have the tube there to, you know, not damage that skin. So basically this is the hole, the yellow is the cartilage, and then you have skin surrounding it. I place sutures here, 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 here. And then those sutures are gonna decrease the chances of it filling back up, and then the hole is gonna continue draining. So now what we do is we laser it to help the healing process. Laser, what it does, it takes more oxygen to that area. It helps the healing, it reduces pain. That helps the healing process go a little bit quicker. After we do laser, we're gonna wrap it. The cat is gonna go home with the wrap. Tomorrow, we're gonna remove that wrap it again, and then after that, that wrap stays in for around 2 to 3 days. After that, we leave it open for it to dry out and heal properly. 14 days from today, we'll remove those sutures and the ear should look normal.